Welcome back. Time now for our first midday forum. Joining us is Dr. Kevin Yiee. Did I get that right? Good. Nice to see you, Doctor.
Thanks, Alan.
With CHI Health. And according to the American Cancer Society, more people are diagnosed with skin cancer each year in the U.S. than all other cancers combined. That's incredible. Again, Dr. Yiee is the medical director of the CHI Health St. Elizabeth Radiation Therapy Center, here to talk prevention and treatment options. Great to see you, Doctor. I was on vacation recently. I thought I was Mr. Smart Guy, Doctor. I thought I could do it without the lotion. 30 minutes, I was red. 30 minutes, I was in Wisconsin. I thought I could get by, and I got burned, and I paid the price, and here I am an adult, and we talk about it, and I tell my kids, put the lotion on you. I failed to do it, and I paid the price. Hopefully, I'm feeling a little better now. My shoulder was a little sore. Even 4 or 5 days later, still a little sore. Anyway, we all know sunscreen is vital to preventing skin cancer, that's for sure. But a recent study shows that chemicals in sunscreens can actually get into our bloodstreams. Now, is that causing concern for you, or should it?
Yeah, so last year there was a small study published in which they had patients apply sunscreen either through a spray, lotion, or cream, and they measured how much of it gets absorbed into your bloodstream, and surprisingly it does get into your bloodstream, and so that caused some concern. But we know from decades of experience that sunscreen prevents skin cancer by as much as 50%. And so based on that experience, there's no reason not to use sunscreen. It's just that we didn't know that some of these got absorbed into your bloodstream.
Okay, so bottom line, keep using it.
Yes.
Right,
yeah.
Okay. Outside of sunscreen, are there other steps? You know, let's say you're at the beach one day, or you're out on a picnic or whatever. You forget the sunscreen. Sometimes we do that. What steps would you advise other than just staying in your car or under a tree or something?
Yeah, I mean, most of the steps are simple, like you said. You know, find shade, wear long sleeves, wear a large brim hat, and use sunglasses. Now, the thing with sunscreen, though, you have to remember that you need to keep reapplying it every 2 hours, and that's what people forget a lot.
Every 2 hours.
Yeah.
Okay, that's maybe, you know, what's the rule about, let's say you're going swimming. Yeah, you throw down and you 5 minutes, 10 minutes, 15. What's the general rule before you jump in the water?
We would recommend at least 15 minutes, or 30 minutes, and try to use 2 tablespoons, apply it liberally throughout your body.
2 tablespoons per for your whole body, you mean?
Correct.
Oh wow.
Yeah.
Okay, depending on your size,
Yeah,
obviously. But
yeah.
Okay, maybe that's the mistake I made. I jumped into Lake Michigan after like 3 minutes of putting the stuff on. That was foolish, I know. But you're so hot, you want to jump in. No one has the patience to wait. You look, but you should. And otherwise, you'll pay the price. So, holding in your hand right there, talk about that. In other words, for this, what is this? What do we have here?
Yeah. So this is an applicator that we use, and so
to do what?
This is to treat skin cancer. So
okay.
So usually when we treat skin cancer, we use surgery, but this is a non-surgical way to treat skin cancer, and so. Wherever you have a spot that needs to be treated, this applicator just goes directly on the spot. It can go on your skin, on your face. And you come in for 2 minutes a day and for 10 sessions, and this will treat superficial skin cancer as well as surgery. So this is a non-surgical way to treat skin cancer in appropriate cases.
Is it relatively new?
We've been doing it for about 7 years now.
Okay, what's it called?
This is called brachytherapy, skin brachytherapy.
Skin brachytherapy.
Correct. So it's a different form of radiation. Usually when you think of radiation, you think of X-rays. But this is a bead that goes into these applicators and sits directly on the skin itself.
Okay. Does insurance generally cover that? Or is
yeah,
it
does. And it doesn't leave a scar, and that's the main advantage.
That's better than surgery for that reason, right? No scar?
Yes. Okay. Yeah. Surgery is a great option too, but this is an alternative.
Okay, excellent. Well, and we know skin cancer is just, as you mentioned early on, a huge problem. And is it, bottom line, and we only have a few seconds here, but if you suspect you might have skin cancer, what are some quick signs you can tell people about?
Well, main thing, go see your doctor. But if you see any changes, if something's growing or changing color, it's an indication to go see your doctor.
Get in, don't wait, because it can kill you.
It can.
Right. Okay, all right. Good to see you, doctor.
All right.
Thanks for coming in.